I think emergency departments can play a number of roles, from primary prevention to intervention when patients come in who have obvious signs or symptoms associated with opiate dependence. Obviously, many people come to the emergency department because they're in pain, either acute pain related to some kind of injury or chronic pain related to a chronic medical condition. The emergency department prescribes lots of opiates in order to help people manage their pain. So there have been some recent initiatives to try to standardize and improve the guidelines associated with prescribing opiates to patients who are in the emergency department in an effort to help to avoid people becoming dependent upon opiate medication, which is one path towards becoming dependent on opiates. So the primary prevention role would be to make sure that the prescription of opiates that are being given to patients who are in the emergency department and who are being treated there or then discharged are being prescribed according to recommended practices. We're trying to identify patients early in the process of their abuse or dependence developing in these patients, and then applying brief interventions during the emergency department visit and helping those patients to connect to appropriate care if necessary on an outpatient basis. For quite a while now, probably about 10 years, there have been really active research programs that have focused on developing techniques and strategies for identifying patients who have opiate problems and other substance abuse problems, providing brief motivational counseling during the visit, and then referring them to care. There are very structured, standardized approaches to do this, and most of it involves applying a standardized screening tool that helps to identify if the person is using opiates, and if so, how much, and whether those opiates are causing problems in their lives. Once that's identified, then we can more appropriately determine what types of interventions are a good fit for the person. So based off of that assessment, we provide brief motivational counseling. This is also done in a specific way. The motivational counseling is designed to help people identify their own internal reasons for stopping or changing their use rather than external reasons. So this form of therapy or of intervention is called motivational interviewing. And then we also do our best to try to match people with the optimal outpatient or inpatient treatment that's suitable for the level of dependence and the level of care that they need.